want to point out those that are wearing the lanyard of the Medical Reserve Corps. We have 50 persons involved in our Medical Reserve Corps throughout Ashland County. And some of you are wearing your lanyards today and others are not. But the Medical Reserve Corps serves a variety of functions. And some of those are medical and non-medical. So as you can think about, let's say maybe the hospital, that there are persons that deal with the building and maintenance and moving supplies and equipment. And we have that type of function within the Medical Reserve Corps. Those that are working behind the scenes today, like Ron and John, and there's some other persons that you don't see out front here. And then there's others who are definitely on the medical side who help us with vaccination clinics in multiple ways. And so the Medical Reserve Corps in Ashland County has been in existence since March of 2007. So it actually started in 2002 on a national level. So it's been around that long, and I, of course, am always looking for persons to volunteer in various ways. And so people usually volunteer in a way that is either on the health education side or perhaps a disaster response, disaster preparedness. Now, briefly this morning, I want to touch on a statement that was made 20 years ago. And I want you to think about those elements, and I'll give you a little, just a touch more information on those elements. A clean bill of health is one of life's most precious gifts, but for many Americans and for millions around the world, good health can seem almost a luxury. The AIDS epidemic, the prevalence of poor nutrition, unplanned pregnancies, and environmental degradation. These are just some of the pressing crises facing hardworking public health officials everywhere. While our society's medical technology has advanced to a level unimaginable to the generations before, the crucial job of ensuring basic public health for all remains just beyond our reach. Now, more than ever, public health programs and services are needed so we can ensure the best possible health for everyone. Providing safe living and working environments, developing methods to immunize populations against infectious disease, maintaining good nutritional standards, and having good prenatal care for everyone are vital endeavors. Every day, thousands of individuals across our country are working to build healthy communities, meet the needs of our diverse populations, plan appropriate responses to natural disasters, and educate individuals about workplace hazards and encourage responsible behavior in all that we do. And so, if you think, this statement was written 20 years ago. And you know, much in public health has not changed. We're still in the business of protecting persons from disease, helping to protect persons from disease, preventing the spread of disease, and certainly what President Clinton said in the very first Public Health Week in April of 1995 still very much applies today. Now we have the proclamation from President Barack Obama up here that you can see. And of course, as time has gone on and things have become more complex, his proclamation is about twice as long. But we have made progress in the AIDS epidemic, but we're still dealing with many of the issues that go to the root of public health. And when President Clinton cited environmental degradation, as well as those things, planning for response to natural disasters, as well as issues involving preventative care, vaccines, and so forth. Those issues are still at the very core of public health. Not much has changed in terms of the core elements of public health, and so I just wanted to touch on that do a retrospective on Public Health Week, this being the 20th anniversary.